Shoulder range of motion, shoulder external rotation. Have your partner lie supine with her shoulder abducted to 90 degrees and elbow flexed to 90 degrees, keeping neutral pronation and supination. Place a towel, face cradle, or half foam underneath the humerus so that it is level with the acromion and that the arm is supported. The axis of rotation is the olecranon process, and motion occurs in the transverse plane. The stationary arm is an imaginary line perpendicular to the floor, and the mobile arm is down the ulna aligned with the ulnar styloid process. Normal range of motion is 90 degrees. Here, Sam has 88 degrees of shoulder external rotation. Shoulder manual muscle testing, anterior deltoid. Have your partner sit at the side of the table with her arm at 90 degrees of shoulder flexion, slight pronation of the forearm, and slight bend at the elbow. Stand at the side being tested and assess available range of motion. Place one hand on your partner's shoulder to help stabilize the trunk, and place the other hand just proximal to the elbow at the distal humerus. Instruct your partner to raise her arm upward as you resist in a downward direction. This will occur in the sagittal plane. The anterior deltoid originates at the anterior lateral 1/3 of the clavicle, inserts at the deltoid tuberosity, and performs flexion and horizontal adduction of the glenohumeral joint. Here, Sam scores a 5. Spinal range of motion, lumbar rotation. Have your partner stand neutral and direct her to cross her arms across her body. Make sure that her knees are not hyperextended. The axis of rotation is the greater trochanter, and the motion will be moving in the transverse plane. The stationary arm is the lateral condyle of the femur, and the mobile arm is in line with the mid-axillary. Instruct your partner to turn towards you. Normal range of motion is 25 degrees. Here, Sam has 24 degrees of lumbar rotation. Spine manual muscle testing, Quadratus lumborum. Have your partner lie supine on her back, holding the edge of the mat table with both hands. Grasp one leg just proximal to the ankle joint, and have your partner hike her pelvis towards her ribs. Pull down on her leg. The Quadratus lumborum originates into the iliolumbar ligament and internal lip of the iliac crest, inserts into the lower border of the last rib, and performs lateral flexion of the vertebral column with ipsilateral contraction and extension of the lumbar vertebral column with bilateral contraction. Here, Sam scores a 5. Hip range of motion, hip adduction. Have your partner in a supine position on the mat table with both legs extended. Move the leg that is not being tested into abduction and adduct the hip being tested. The axis of rotation is the anterior superior iliac spine. This motion will occur in the frontal plane. The stationary arm is along an imaginary horizontal line connecting the anterior superior iliac spines of both hips, and the mobile arm is down the midline of the femur. Normal range of motion is 35 degrees. Here, Sam has 34 degrees of hip adduction. Hip manual muscle testing, gluteus medius. Have your partner lie on her side with the testing leg on top and a slight extension from neutral. The bottom leg may be flexed for balance. Instruct your partner to lift up her leg and avoid bringing her leg closer to the chest. Assess your partner's range of motion. Stand behind your partner and place one hand on the iliac crest, stabilizing the pelvis. Place your other hand just proximal to the knee joint at the distal thigh, resisting in a downward direction throughout the test. Ensure that the leg is in a neutral position and not externally rotated. The hip should remain in place as external rotation is a substitution pattern common with gluteus medius muscle weakness. The gluteus medius originates at the iliac crest and inserts at the greater trochanter. It performs hip abduction and internal rotation, along with hip extension and lateral rotation. Here, Sam scores a 5.